Medellin, Colombia. I'm seated here in Dr. Juan Pablo Dueñas' clinic. Juan Pablo, Dr. Dueñas, nice to see you.
My friend, welcome to Medellin.
Thank you.
Great to see you here.
It's nice to be here. And the reason I came is to visit Dr. Dueñas because he is one of the top thyroid ablation doctors in the world. And you've been treating, you're really one of the pioneers. You were the first in Colombia to practice thyroid ablation. One of the first in the Americas, other than Brazil, because Brazil was a forerunner.
Yes. They start maybe 1 or 2 years before me. So this is very interesting because when we start in 2020, before the pandemic began and come to us, at that time, the fact in the results of the thermal ablation have a lot of strong evidence, and it was very interesting how the pandemic increased the interest in this kind of alternatives, the best alternatives for many patients. And today is one of the first line of management of benign nodules. Maybe it could be the first line of management for functional nodules or even for thyroid cancer. So this is very interesting, my friend.
Yeah, so Dr. Dueñas is treating thyroid cancer, large goiter, without surgery, but you are a surgeon. When surgery is required, you're able to treat it with a surgery. But you advocate for non-surgical treatment of thyroid cancer or thyroid nodules when possible.
Yes, I realized many years ago, maybe in 2018, that we have in the world another alternatives for many patients, because I have the feeling at that time that we operate more patients that those patients that require surgery, maybe unnecessary surgeries for many patients for benign nodules, and this is very sad situation that one patient with a benign nodule requires surgery. The first line of management are thermal ablations. So the spectrum of the alternatives and indications for thermal ablations has increased with time, and I think this is only the beginning of the future of these treatments.
You know, the title of this video is the most important video you're going to watch if you're diagnosed with a thyroid nodule.
Okay.
And the reason is, like you said, there are so many thyroid nodules diagnosed in the world, in the Americas. And a lot of doctors are not like you. A lot of doctors will say the first line of defense is surgery.
No.
So I think it's very important for them to hear from a surgeon who is advocating for avoiding surgery to preserve your thyroid. So let's start with this, Dr. Dueñas. What are the ailments? What are the problems you see that can be treated with thyroid ablation and not surgery?
Okay. The first indication and the most important indication nowadays is the benign nodules have produced with symptoms. What kind of symptoms? The symptoms of the benign nodules could be in two ways. Of cosmetic symptoms, that it means that you could see your nodule, and this is a very sad situation for the patients.
Is that a goiter?
A goiter, because you see a bulge, a big bulge in your neck, and this is very sad for the patients, obviously. And the second indication is you have a benign nodule that produces compressive symptoms. You could feel a pressure in your neck every time, and with difficult for swallowing or for eat. So those patients with this kind of symptoms, cosmetic or symptoms
physical.
Yeah,
because sometimes the nodule can get in the way of breathing or eating or swallowing.
Only swallowing, and this is very uncomfortable for every single person that could have it. So in this kind of patients with this kind of symptoms, the first line of management is the thermal ablation, not surgery, because the most important objective with the thermal ablation is one, realize the symptoms. We need to improve the symptoms, and if you could achieve a 50% of reduction of the volume of the nodule, you could improve the symptoms, even cosmetic or even obstructive symptoms. This is awesome. But the most important part of this is the patient don't require surgery, don't have a scar, but the most important is the preservation of the function of your thyroid gland.
Okay, we're going to get to that. The preservation of the function of the thyroid gland in a moment. I think it's important to clarify really quickly that you can treat thyroid cancer with ablation.
Yes.
And you're doing it. Not only can you,
yes,
you are treating thyroid cancer.
Yes. The treatment for the low-risk thyroid cancer includes 3 management options. The first one is active surveillance, and the ideal patient for active surveillance is the patient that have a papillary thyroid carcinoma less than 1 centimeter with at least 2 millimeters of the thyroid tissue surrounding the nodule, obviously without a lymph node suspicious of compromise with the tumor. Those patients that could be under an active surveillance program are the ideal patient for thermal ablation. Actually, the American Thyroid Association released the new guidelines 1 or 2 months before, and the level of evidence of the active surveillance today is the same level of evidence for thermal ablation. So this is a very good option for patients that don't want active surveillance and don't want to go undergo surgery. So this is very important because today we have a strong evidence for the benefits for those patients with low-risk thyroid cancer less than 1 centimeter.
And I can speak as a patient, you know, in some cases, a patient can have thyroid cancer and have active surveillance. I can put a link to a video with Dr. Miyauchi, where he's in Kobe, Japan. He's the pioneer of active surveillance.
Yeah.
And he will say that all of his patients, none of the thyroid cancer patients he has observed have died from thyroid cancer. So that's one way. But what we know too, some patients, when they hear thyroid cancer,
doesn't want active surveillance.
They don't want active surveillance for a peace of mind.
Yeah.
And those before years ago, they would opt for a surgery that they really didn't need. But I think what's cool about ablation, it's a good middle ground.
It's a bridge.
It's a bridge because
it's a bridge between active surveillance and surgery.
And the paranoid patient, you know, if you told me I had thyroid cancer and it's not going to kill me, and Dr. Miyauchi said you're going to be okay, I'm fine with active surveillance. But many patients, others, and he even says, some hear they have thyroid cancer, they say take it out. And for that.
Yes. Actually, in the States or even in Latin America, the patients are under active surveillance program. Between 20 to 30% could migrate to surgery due to anxiety.
Anxiety, right?
Anxiety.
Their anxiety, they think, I have this cancer.
Yes. And this is a very good option for those patients that want some treatment and don't want surgery.
Yeah.
This is a very good option.
Can we pause for a minute, Dr. Dueñas, and make sure that people watching understand that many symptoms, thyroid nodule, whether it's cancer, goiter, they don't need to have surgery.
Yes.
And they need to hear from a surgeon.
Actually, my practice changed in the last 5 years because I am surgeon, and before 2020, I operate 100% of my patients. Nowadays, 60% of patients require surgery, and 40% of my patients requires thermal ablation.
So good. That's exciting. 60% surgery, 40% ablation. You know, let's talk about this topic too. It's kind of going off on a tangent, But some surgeons hearing this will think, I'm not going to make as much money. Some think that way. How do you respond to them? You're saying, in fact, we're going to reduce how many surgeries we do.
Okay. I think that the first thing that we have to take in account is the benefits for the patient.
Put the patient first.
The patient first. I don't think I don't do surgeries or thermal ablation for money because it is extremely unethical. But if you think in your patients, with your patients, and take decisions with the patients, at the end of the days, you could go to the bed and sleep in the best way. I think that we have to be very, very, very ethical with the decisions with our patients.
And I was here today when you were treating your patients, and there is what I sense, some heartfelt that you have for each patient. And they also seem to feel that. And I'm just measuring by reaction and by your interaction.
The interaction.
It's good. And it's different. I can speak as a patient. It's different than what I have experienced in some cases. And I'm sure some of them have experienced in some cases. And it's special when a patient can be with a doctor. You can feel it. They have empathy.
Empathy. This word requires more empathy for every single of us. Empathy is the best way to do the things.
Okay, so listen, this is good. I think this is in fact the most important video they're going to watch if they're diagnosed with a thyroid nodule, because there are options to avoid surgery. If you want to know more information, they can go to RFAMD.com. Also, you'll see a page featured with Dr. Duenas with all of his information. He's available for consultations. And you're getting more international patients now.
Okay.
Right?
The final message from me is, if you have a diagnosis of thyroid cancer, you could have 3 options of management: active surveillance, surgery, or thermal ablation. It could be a very good option.
How do you work with international patients?
I have a lot of international patients. Every month I think that I treat at least 2 patients outside of Colombia, many of them from the States.
Yeah, I think it makes sense. It's a flight. It's no different if you're coming from the US.
It's too close.
It's the same as going from California to New York,
Yeah.
It's not a big deal.
It's even shorter.
It's even shorter.
Yes.
It's even shorter. Listen, thank you.
No, thank you very much. Thank you.
Dr. Duenas, before we say farewell, any final thoughts?
No. You will have options even you have thyroid cancer. We need to look for the physician that could resolve all your questions.
Guys, quality of life.
Quality of life and empathy.
Empathy, preserving your thyroid. It's really, if they take anything away from this interview, take that away.
Thank you very much. And thank you.
Farewell from Medellin. Bye-bye.